This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I'm Valsa Williams and with me is Vaibhav Srivastav. The headlines. Prime Minister Narendra Modi interacts with leaders of various political parties, says COVID-19 outbreak is a social emergency. Prime Minister asserts that saving each and every life is the priority of his government. Several states and experts ask Centre for extension of lockdown period, Prime Minister to interact with all chief ministers on Saturday. Focus in COVID-19 management to be on building hospitals, surveillance and contact tracing. Supreme Court directs Centre to facilitate free testing of COVID-19 in government and private labs. Government decides to issue all pending income tax refunds up to 5 lakh rupees immediately, also to release GST and custom refunds. Describing the ongoing situation arising out of the COVID-19 outbreak as akin to a social emergency, Prime Minister Narendra Modi has asserted that the priority of his government is to save each and every life. Mr. Modi said the country has been forced to take tough decisions and it must continue to remain vigilant. Interacting with leaders of political parties in Parliament through video conferencing, the Prime Minister said several state governments, district administrations and experts have asked for extension of the phase of lockdown to contain the spread of the virus. He noted that in these changing circumstances, the country should simultaneously try to bring about a change in its work culture and working style. The Prime Minister said the country is facing serious economic challenges as a result of COVID-19 and the government is committed to overcome it. Saying that the entire world is currently facing the grave challenge of COVID-19, Mr. Modi added that the present situation is an epoch-changing event in mankind's history and India must evolve to counter its impact. He praised the efforts of state governments working together with the centre in this fight against the pandemic. Mr. Modi said the country has witnessed constructive and positive politics through the coming together of all sections of polity to present a united front in this battle. The Prime Minister also praised the sense of belonging, discipline, dedication and commitment with which each and every citizen is contributing in this endeavour, be it in following social distancing, Janata curfew or the lockdown. Mr. Modi emphasized the impact of the emerging situation as witnessed in the resource constraints. He said India has been among the few nations to control the pace of spread of the virus till now. He also cautioned that the situation keeps changing continuously and one needs to maintain vigil at all times. Our correspondent reports that leaders of different political parties provided feedback, suggested policy measures and discussed the way forward.
The leaders appreciated the Prime Minister for timely measures taken by him. They said the entire country is standing united behind him during the crisis, boosting the health and morale of the healthcare workers, ramping up testing facilities, the need to assist smaller states and union territories, and tackling the challenges of hunger and malnutrition were discussed. They also spoke about economic and other policy measures to boost the country's capability in this battle against the pandemic. Suggestions were also given by the leaders on extending the lockdown and on a phased exit after lockdown ends. Sobhagyakar, Air News, Delhi.
Congress leader Ghulam Nabi Azad, Shiv Sena leader Sanjay Raut, DMK leader T.R. Balu, Sharad Pawar from NCP, Rajiv Ranjan Singh of JDU, Lok Jan Shakti Party's Chirag Paswan, Professor Ram Gopal Yadav of Samajwadi Party, BSP's Satish Chandra Mishra were among those who participated in the interaction. Prime Minister Modi will interact with chief ministers of all states on Saturday on the COVID-19 situation. Earlier, the Prime Minister had 2 interactions with the chief ministers over the issue.
Prime Minister Narendra Modi has urged people to download the Arogya Setu mobile app, saying it is an important step in the fight against COVID-19. Mr. Modi said by leveraging technology, the app provides important information. He said as more and more people use it, its effectiveness will increase. The mobile app is to bring the people of the country together in a resolute fight against COVID-19. It enables people to assess for themselves the risk of their catching the coronavirus infection. Our correspondent reports the app calculates this based on their interaction with others using cutting-edge Bluetooth technology, algorithms and artificial intelligence. In an apparent reference to reports that some people are campaigning to honour him by standing for 5 minutes, Prime Minister Narendra Modi said, at first glance, it seems a mischievous attempt to drag him into a dispute. He said, if the people behind this reported campaign really have so much love and want to honour him, then they should take the responsibility of a poor family, at least as long as the coronavirus pandemic exists. The Prime Minister said, there can be no greater honour for him than this. The Prime Minister's tweets came after a poster surfaced in the social media asking for a standing ovation for him from citizens this Sunday.
The total number of COVID-19 cases in the country rose to 5,274 today, registering an increase of 485 cases in the last 24 hours. So far, 411 people have recovered and been discharged from hospitals, while 149 have lost their lives in the country due to COVID-19. Briefing reporters in New Delhi today, Joint Secretary in the Health Ministry, Love Agarwal, said, as the number of COVID-19 cases are rising in the country, the government's response and preparedness are intensifying accordingly.
कि हमने अपने हॉस्पिटल फैसिलिटीज को क्लासिफाई करते हुए टेम्परेरी हॉस्पिटल्स के रूप में, जिसको हम कोविड केयर सेंटर्स बताते हैं, उसके तहत हम अपने इन जो लेस सिम्टम, माइल्ड सिम्टम्स वाले लोगों को हैं, उनको हम कैसे ऑर्गेनाइज कर सकते हैं, कैसे ट्रीट कर सकते हैं, इसके बारे में हम लोगों ने जैसे होटल्स हैं, लॉजेज हैं, हॉस्टल्स हैं, जरूरत पड़े तो स्टेडियम्स को भी कैसे इस्तेमाल कर हम अपना फील्ड लेवल इंफ्रास्ट्रक्चर बढ़ा सकें.
He said dedicated healthcare centres and hospitals are being set up for critical cases. Mr. Agarwal said the centre has told states to continue its focus on building hospitals and on surveillance and contact tracing.
फील्ड लेवल पर ओरिएंटेशन एंड ट्रेनिंग एक बहुत इंपॉर्टेंट कंपोनेंट है, जबकि हम कोविड-19 को पूरे देशव्यापी लेवल पर मॉनिटर करना चाहते हैं. तो उसी के तहत मिनिस्ट्री ऑफ ह्यूमन रिसोर्स एंड डेवलपमेंट ने कोविड-19 मैनेजमेंट के लिए एक ट्रेनिंग मॉड्यूल लॉन्च किया है, जिसका नाम है इंटीग्रेटेड गवर्नमेंट ऑनलाइन ट्रेनिंग पोर्टल, जिसमें कि फ्रंट लाइन वर्कर्स की कैपेसिटी बिल्डिंग के बारे में उनको रिक्वायर्ड रिसोर्सेज प्रोवाइड की जाएंगी. इस प्लेटफॉर्म के द्वारा डॉक्टर्स, नर्सेज, पैरामेडिक्स, टेक्नीशियंस, एएनएम्स और साथ ही राज्य के जितने अधिकारीगण हैं, सिविल डिफेंस ऑफिशियल्स हैं, नेशनल कैडेट कॉर्प्स के जो हमारे वॉलंटियर्स हैं, नेशनल सर्विस स्कीम के वॉलंटियर्स, रेड क्रॉस सोसाइटी और जितने भी वॉलंटियर्स हैं, उनको भी रिक्वायर्ड रिसोर्सेज प्रोवाइड की जाएगी.
Stating that COVID-19 is an infectious disease, he sought the support of the public in following the social distancing measures and lockdown. Mr. Agarwal also said the country has sufficient stock of hydroxychloroquine. Joint Secretary in the Home Ministry, Punya Salila Srivastav, said the cash benefits of 1,000 to 6,000 rupees have been announced by the Centre for Registered Construction Workers. Under this, 3,000 crore rupees have been given to 2 crore registered construction workers till now. She said state governments have increased the enforcement of lockdown in hotspots through more intense police monitoring and spreading awareness with the help of community leaders.
3.5 करोड़ पंजीकृत बिल्डिंग एंड कंस्ट्रक्शन वर्कर्स को सहायता देने के लिए राज्य सरकारों को आदेश दिया गया था कि वे बिल्डिंग एंड कंस्ट्रक्शन वर्कर्स वेलफेयर फंड का उपयोग करें. इस कोष में लगभग 31,000 करोड़ की राशि उपलब्ध है. राज्य सरकारों ने इस निर्देश का क्रियान्वयन आरंभ कर दिया है. 31 स्टेट्स और यूटीज ने 1,000 से लेकर 6,000 रुपए तक के कैश बेनिफिट्स अनाउंस किए हैं. 2 करोड़ से ज्यादा श्रमिकों को लगभग 3,000 करोड़ की राशि दी गई है.
Head scientist in the Indian Council of Medical Research, Dr. Raman Gangakhedkar, said over 1,21,000 tests for COVID-19 have been done so far.
आज तक हमने 1,21,271 टेस्ट किए हैं. उनमें अगर कल का अगर आप देखें तो 13,345 टेस्ट हुए हैं. उसमें प्राइवेट लैब्स में 2,267 टेस्ट हुए हैं और अभी इस वक्त 139 लैब्स आईसीएमआर नेटवर्क में एक्टिव हो गई हैं और 65 प्राइवेट लैब्स को हमने परमिट किया है.
The Supreme Court today directed that COVID-19 tests in approved government labs or private laboratories should be conducted free of cost, and the centre should immediately issue directions in this regard. The top court said the private hospitals, including laboratories, have an important role to play in containing the scale of the pandemic by extending philanthropic services in the hour of national crisis. A bench of Justices Ashok Bhushan and S. Ravindra Bhatt, which heard the matter via video conferencing, said that the tests relating to COVID-19 or novel coronavirus must be carried out in the National Accreditation Board for testing in calibration laboratories, accredited labs or any agencies approved by WHO or ICMR. The bench said it is issuing the interim directions to the respondents that the tests relating to COVID-19, whether in approved government laboratories or approved private laboratories, shall be free of cost. The bench also said the respondents, centre and other authorities shall issue necessary direction in this regard immediately. The top court said that even before the COVID-19 was declared a pandemic by WHO on March 11th, it had spread in several countries, and as of now, more than 200 countries are suffering from this pandemic. The top court issued directions on a PIL filed by an advocate seeking a direction to the centre and authorities to provide free of cost testing facility for COVID-19 to all the citizens in the country. The bench in its order said no person be deprived to undergo the COVID-19 test due to non-payment of capped amount of 4,500 rupees. It noted the centre's submission that government laboratories are conducting the COVID-19 tests free of cost.
Pharmacists of Pradhan Mantri Jan Aushadhi Kendra are delivering essential services and medicines at the doorstep of patients and the elderly under Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana to fight the COVID-19 pandemic. Our correspondent reports that this initiative is supporting the practice of social distancing.
During the lockdown period, all Pradhan Mantri Jan Aushadhi Kendras are playing a key role in ensuring availability of essential medicines and delivering them at the doorstep of patients. Pharmacists of these Kendras are extending essential services by making available quality generic medicines at affordable prices to the common people of the country. More than 6,300 Pradhan Mantri Jan Aushadhi Kendras are functioning, covering 726 districts of the country. Citizens can also use Jan Aushadhi Sugam app to locate their nearest Kendras and availability of medicines with their price. The app can be downloaded from Google Play and iPhone Store. Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana is also generating awareness through informational posts on its social media platforms to help people protect themselves from coronavirus. With Tipendra Anand Kumar, AIR News, Delhi.
The Home Ministry has directed states to ensure availability of essential goods at fair prices for the public at large. In a letter to Chief Secretaries, Home Secretary Ajay Bhalla has asked the states to deal strictly with offences of hoarding, black marketing, profiteering and speculative trading. He asked them to ensure proper supply of food items, medicines and medical equipment by invoking provisions of Essential Commodities Act 1955. Mr. Bhalla emphasized that measures, including fixing of stock limits, capping of prices, enhancing production, inspection of accounts of dealers and other such actions will be undertaken by the states at the earliest and at regular intervals to ensure production and supply of essential commodities. He said those not complying may be dealt with severely as offences under the Essential Commodities Act are considered as criminal offences and may result in imprisonment for 7 years.
The centre has taken a number of initiatives to ensure availability of medical supplies amid the lockdown. Indian Railways has geared up its efforts to produce personal protective equipment, PPEs, on a mission mode. Railway workshops are being geared up to produce 1,000 PPE overall every day for railway doctors and paramedics. The production facilities will be ramped up in the future. Railways is also considering to supply 50% of PPE material to other medical professionals of the country. The PPE overall produced by Jagdari Workshop was recently cleared by the Defence Research and Development Organization's lab. Approved design and material will now be used for making protective overall by 17 railway workshops situated in different zones. The PPE overall will offer much needed protection to railways doctors and paramedics working as frontline warriors for treating corona patients. Tribal Affairs Minister Arjun Munda has written a letter to the Chief Ministers of 15 states to advise the state nodal agencies for undertaking procurement of minor forest produce MFP at the minimum support price MSP in right earnest. These states include Uttar Pradesh, Gujarat, Madhya Pradesh, Karnataka, Maharashtra, Assam, Andhra Pradesh, Kerala, Manipur, Nagaland, West Bengal, Rajasthan, Odisha, Chhattisgarh and Jharkhand. Mr. Munda said that the current situation brought about due to the outbreak of COVID-19 has posed an unprecedented challenge across the country. He said this being the peak season for collection and harvest of minor forest produce MFP and non-timber forest produce NTFP in many regions makes it imperative to initiate certain proactive measures to ensure the well-being of the tribal communities and their economy by providing them safety and ensuring their livelihoods.
The government has termed the reports which claim that hotels and restaurants will remain closed till the 15th of October 2020 due to COVID-19 outbreak as fake. In a tweet, the Press Information Bureau said the order running in social media in this regard is fake and has not been issued by the Tourism Ministry.
This is All India Radio, bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi interacts with leaders of various political parties, says COVID-19 outbreak is a social emergency. Prime Minister asserts that saving each and every life is the priority of his government. Several states and experts are centre for extension of lockdown period. Prime Minister to interact with all chief ministers on Saturday. Focus in COVID-19 management to be on building hospitals, surveillance and contact tracing. Supreme Court directs Centre to facilitate free testing of COVID-19 in government and private labs. And government decides to issue all pending income tax refunds up to 5 lakh rupees immediately. Also, to release GST and custom refunds. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Minister of State for Personnel, Public Grievances and Pensions, Dr. Jitendra Singh, today handed over a consignment of 2,200 essential kits for distribution to needy families in Delhi in the wake of COVID-19. Each such kit, consisting of 9 items, is meant to assist one needy family for some time. The items include 3 kilograms of rice and wheat flour, 1 kilogram pulses, 1 litre cooking oil, 500 gram chivra, 1 kg salt, 1 bathing and detergent soap and 3 packets of biscuits. Kendriya Bhandar, which functions under the Department of Personnel and Training, has taken the unique initiative of providing essential kits to needy families. Delhi Lieutenant Governor Anil Baijal today appealed to all religious leaders, resident welfare associations and parents to advise young people to observe the Shab-e-Barat occasion solemnly and not to step out together in the wake of the COVID-19 pandemic. In a message, the Lieutenant Governor said Delhi is under lockdown amidst the coronavirus outbreak. Therefore, people are requested not to step out of their houses and to pray for their families' security. He said everyone should desist from any behavior that compromises with the safety guidelines for battling coronavirus.
In Madhya Pradesh, the state government today invoked the Essential Services Management Act, ESMA, with immediate effect to tackle the novel coronavirus spread. In a tweet, Chief Minister Shivraj Singh Chauhan informed that in a bid to manage the COVID-19 outbreak in a better way and in the interest of the citizens, the government has implemented the ESMA with immediate effect in the state. In Jammu and Kashmir, the Labour Department is working tirelessly to mitigate the sufferings of the stranded labourers in the Union Territory due to COVID lockdown. To seek any assistance, the Labour Department has notified helpline numbers and the labourers can contact the concerned officers. In Jammu Division, the stranded labourers can contact Raman Sharma on 7006 382985, Pavan Kumar on 9419 805327, Roshan Lal on 9419 211 429 and Shivalik Sharma on 7889 663 050. In the Kashmir division, they can contact Shaukat Shafi on 8899 546373, Ansar Ahmad on 7006 286174 and Mushtaq Ahmad Beg on 9697 977487 for any assistance. To know about more efforts of the department, let's listen to our Srinagar correspondent.
To ensure welfare of workers and migrants stuck in Jammu and Kashmir due to COVID lockdown, Labour Commissioner Jammu and Kashmir Abdul Rashid has said that several initiatives are being taken by the administration to ensure good mental health of migrant labourers, for which several counselling sessions are being organised. He said the counsellors have visited 142 camps and shelter homes across J&K, where they have provided counselling to 5,761 floating population of migrant labourers stuck in different parts of J&K. Labour Commissioner said that 1,43,866 board and other construction workers have been handed over 1,000 rupees each, amounting 14.36 crores rupees. He said that department is leaving no stone unturned in reaching out to these workers who constitute the poor sections of the society. This is Sunil Kohl for AR News from Srinagar.
Maharashtra's Health Minister Rajesh Tope has informed that the total number of COVID-19 patients in the state has increased to 1,135. Speaking to reporters in Mumbai today, Mr. Tope said 117 patients have recovered from the disease and have been discharged. Reiterating that there is no community transmission at present, the minister said the course of the spread has not been as steep as seen in European countries. With the number of deaths being 66, the state has also recorded the worst death ratio of almost 6% amongst all Indian states. With Dharavi recording its 10th positive case today, the minister said there has still been no decision to seal the area. He, however, said that lockdown in the area will be strictly imposed to ensure that the disease is kept under check. When asked about the use of rapid testing kits, Mr. Tope said the results of these kits are not 100% satisfactory, but still will be used if approved by the centre. More from our correspondent.
In his video message, Maharashtra Chief Minister Uddhav Thackeray has urged citizens to wear face masks while venturing out to buy essentials. He clarified that the mask need not be a surgical or N95 one, but even a protective cloth round the face would suffice. He also informed that the state government has started to designate 3 separate hospitals for people suffering from COVID-19. The first one will serve patients with mild symptoms, the second with severe symptoms, and the third will be reserved for critical patients who are also suffering from comorbidities. Stating that Wuhan returning to normalcy after a period of almost 3 months should serve as an example, Mr. Thackeray said citizens must strictly follow lockdown to curb the spread of virus. Meanwhile, the state government has announced that personal protective equipment kits and N95 masks made by private firms can only be sold in markets after they are certified by the state-run Hafkin Biopharmaceuticals Corporation. Nisha Rani, AIR News, Mumbai.
In Uttar Pradesh, the famous music festival held at the Sankat Mochan temple in Varanasi every year will be digitally accessible this time due to the lockdown to contain novel coronavirus. We have a report.
The 97th Sankat Mochan Sangeet Samaroh of the famous Sankat Mochan temple of Varanasi is going to be unique this time. The performances during the annual 6-day-long musical function will be on digital platforms this time, and the maestros like Pandit Jasraj, Ajay Pohankar, Ustad Rashid Khan and many others are happily ready to perform. Mahant of the temple, Professor Vishwambarnath Mishra, told AIR,
क्योंकि हनुमान जी के निमित्त यह कार्यक्रम होता है, हनुमान जी को ही लोग सुनाते हैं, तो अपनी स्वरांजलि हम लोग डिजिटल माध्यम से कोई फेसबुक लाइव होके या जिस भी डिजिटल माध्यम से वो जुड़ेगा हम लोगों से, तो 12 तारीख से 17 तारीख तक जो शेड्यूल है हमारा 7:30 बजे शाम से लेकर जब तक वो लोग अपना भेज सकेंगे.
The lockdown may have prohibited the gathering, but technology has paved the way for music lovers and devotees to get the chance of listening live to the galaxy of artists. For AIR News, this is Sushil Chandra Tiwari.
In Rajasthan, the number of corona-infected persons has gone up to 363 after 20 new corona-positive cases were reported today in the state. The highest 12 fresh cases have been reported in Jaipur, 6 in Bikaner, and 1 case has been reported in Banswara and Jodhpur each. Chief Minister Ashok Gehlot held a meeting with ministers and officials today through video conferencing and took several important decisions regarding the procurement of rabi crops.
It has been decided to start the procurement of commodities from April 15 in a phased manner under minimum support price mechanism and open procurement system. Procurement will begin at 800 locations including agriculture mandis in a phased manner. The Chief Minister has given instructions to ensure compliance of protocol related to social distancing at procurement centers. Meanwhile, the state government has allowed medical and foodstuff factories to start work without any permission. Fertilizer, pesticide and seed packing factories will also need not to take any permission from any department to work. Jitendra Dwivedi, AIR News, Jaipur.
The government has decided to issue all the pending income tax refunds up to 5 lakh rupees immediately. This will benefit around 14 lakh taxpayers. It has also been decided to release all pending GST and custom refunds, which will provide benefit to around 1 lakh business entities, including MSME. The total refund granted will be approximately 18,000 crore rupees. The decision has been taken in view of the COVID-19 situation and with a view to provide immediate relief to business entities and individuals.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Randeep Guleria, Director AIIMS, said that people should engage themselves in various activities in their homes to keep them mentally and physically fit during the lockdown.
घर के अंदर एक एरिया बना लें जहाँ पे आप वॉक कर सकते हो। दूसरा इम्पोर्टेंट इशू इज मेंटल हेल्थ। इसमें ये बहुत जरूरी है कि हम लोगों से सोशलाइज करें, जो परिवार के लोग हैं उनके साथ इकट्ठे बैठ के बात करें। कुछ इंडोर गेम्स खेल सकते हो, कार्ड्स हैं तो कार्ड्स खेल सकते हो, इकट्ठे बैठ के कोई टीवी पे मूवी देख सकते हो। इस टाइप के कई एक्टिविटीज कर सकते हो जिससे आप सोशलाइज भी कर लें। ज्यादा हुआ तो अपने दोस्तों के साथ फोन पे बात कर सकते हो, चैट कर सकते हो, जिससे आप अपने आप को बिजी भी रखो, मेंटली स्ट्रांग रखो।
Dr. Raman Gangakherkar, head scientist ICMR, said in most of the COVID-19 cases, the infections are self-limiting and only few patients are required to be admitted in hospitals. Talking to All India Radio News, he said the elder people suffering from diseases like diabetes are more prone to catch the infection.
100 में से 5 लोग हॉस्पिटल में भर्ती होने का चांस होगा और उन 5 लोगों में से हमको शायद 5 में से 2 लोग होंगे या एक इंसान ऐसे होगा कि जिसको वेंटिलेटर की जरूरत पड़ेगी, ऑक्सीजन देने के लिए हमको उससे लड़ाई करना पड़ेगा। लेकिन सबसे बड़ी बात क्या है, इसमें मौत का डर हमको इतना क्यों चाहिए? हमने एक समझना है कि मौत का डर ज्यादा किसको होता है? जिसकी उम्र 60 साल के ऊपर है, जिसको डायबिटीज या ब्लड प्रेशर की बीमारी या उसको दमे की शिकायत है या कोई हार्ट का कोई प्रॉब्लम है, इन लोगों में हमको ये तकलीफ होने का चांस पड़ेगा।
Celebrities continue to support social distancing and lockdown measures to contain the spread of COVID-19. We have actor Sanjay Mishra sharing his view.
इस वक्त दुनिया बहुत ही विकट सी परिस्थिति से गुजर रही है। राजा हो या रंग, सबके जान पे बना है। कोरोना वायरस की ऐसी कोई दवा हम तक नहीं पहुंची। सिर्फ सोशल डिस्टेंस ही कोरोना वायरस से लड़ने का एक तरीका है और यही इसकी दवा भी। इसलिए मैं आपसे निवेदन करता हूं कि आप जहां रहें, अपने घरों में रहें, साफ सफाई का ध्यान रखें और कोरोना वायरस के इस परिस्थिति से लड़ने में अपनी सरकार की, देश की शांतिपूर्वक मदद की।
Senior cricketer Harbhajan Singh also appealed to people to remain at home and stay safe.
तो आप सबके सहयोग की जरूरत है। हर एक नागरिक को यहाँ पे अगर बचाना है तो आप सबकी जिम्मेवारी बनती है कि आप कंधे से कंधा मिला के इस मुहिम में जुड़िए, घरों में बैठिए। और छोटी सी विनती है मेरी आप सबसे, आप स्वस्थ रहिए, सुखी रहिए, बट घरों में बने रहिए और सबके लिए दुआ करिए जो इस बीमारी से जूझ रहे हैं कि वो जल्दी से ठीक हों।
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a special discussion program on COVID-19. Dr. Mohan Rao, distinguished scientist, CSIR, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115-767. I repeat, 1800-115-767. You can also ask questions on our telephone number 011-2331-4444. I repeat, 011-2331-4444. And post queries on our Twitter handle @AIR News Alerts by the hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website, newsonair.com, and on our YouTube channel, News on Air Official. You can also follow us on the News on AIR app for updates.
More than 750,000 coronavirus cases have been recorded across Europe, according to an AFP tally compiled from official sources. That accounts for more than half of the cases identified worldwide so far, although the official figures probably reflect a fraction of the actual number. With at least 750,276 cases and 58,627 recorded, Europe remains the continent hit hardest by the pandemic. And now, before we end the program, the headlines once again. Prime Minister Narendra Modi interacts with leaders of various political parties, says COVID-19 outbreak is a social emergency. Prime Minister asserts that saving each and every life is the priority of his government. Several states and experts ask Centre for extension of lockdown period. Prime Minister to interact with all chief ministers on Saturday. Focus in COVID-19 management to be on building hospitals, surveillance and contact tracing. Supreme Court directs Centre to facilitate free testing of COVID-19 in government and private labs. And government decides to issue all pending income tax refunds up to 5 lakh rupees immediately, also to release GST and custom refunds. With that, we end the special news program on COVID-19.